So biohack your back. It's always interesting being a chiropractor or having studied chiropractic, because as soon as you tell somebody that that's what you do and you specialize in posture correction, everybody's like, So you're probably all assessing your posture. How am I sitting? What is she looking at? What are my shoes doing? Like it's the funniest thing. So today, obviously, I'm going to go through what we're going to be speaking on, but I'd like to start with just being grateful for being here, because it's been a long time coming, Tim and I discussing this. So really grateful to just be on here talking to your tribe and giving you a bit of crazy, because I'm not going to lie, some of these concepts, they can be a bit crazy. But the good thing is, at the end, come and have a chat to us, because we can show you that stuff on your body. So if you've got the time, please stay afterwards and come and chat to us. So grateful to be here. Going to be working with a genius, my colleague Stuart Murray. He'll be talking after me. And then I've got Ben Wells, who is part of our office. He's joining us, so he's an ABC expert. And then my mom. My mom's from South Africa. She's visiting. She's never... Yeah. I've been speaking for about 5 years now, but she's never seen me speak in an event, so it's quite cool. Yeah. All right, so question one, first of all. Obviously, the questions, I was going to ask you all the questions that actually Chris and Tim have asked you, so it's cleared up a lot of questions. But I did want to see a show of hands of people who know that your posture and your structure is directly related to your function and your health and your wellness. Who agrees with that statement? Okay. Who isn't sure? Yeah, and who says no? Okay, good. So we're on this side of the spectrum, which is brilliant. Also, I just wanted to get a feel again for people who, in terms of surviving and thriving, because I know in a community like this, our goal is to thrive and be the best you can be. Who is still in the surviving mode, where you're still checking out things and getting, who's surviving? Okay, great. And then who's thriving? And somewhere in between, I'm sure there's a few things. Great, okay, so that gives me a little bit of an overview. So what are we going to do at this meetup? I'm going to turn it on there. Important because I'm going to be speaking to the whole spectrum of you, and obviously hopefully taking something away with you today. What am I missing? Now, from what I've read, there are hundreds of thousands of biohacks that you can do. Sometimes you get really overwhelmed with it. You know, is it your sleep? Is it your water? Is it your genetics? Go and get tested. Is it your, supplement and injection, O2 therapy? Is it maybe something emotional, spiritual? Could I be doing something with exercise to make me better? This is where I'm hoping today is going to put another tool in your toolbox to address the things that maybe aren't going right for you. So you're working and using the supplement that everybody else is getting amazing results with, but for some reason your body is just not doing its thing. So I'm hoping to give you some answers today that just with what I'm going to talk about in terms of ABC. It's quite a mouthful. It starts for Advanced Biostructural Correction. So I'm just shortening that through the talk to ABC. And I mean, what's the point of looking young, having stem cell injections? I mean, I saw an interview with Dave Asprey where he wants to live, and correct me if I'm wrong, he said 180, 200? Yeah? He said also, which bowled me over, that there's people born now who are going to live for thousands of years. So, I mean, that's a very interesting concept. But if your structure is not good and sound and you can't keep it there, what's the point of looking 20 years old and having a muscle, percentage and function when you might have a structure that's falling apart? So this is some of the questions that obviously we're going to answer today. A little bit about how I speak. I'm trying to speak slowly because I get passionate about what I'm saying. So, and can everyone hear me? Can everyone hear me at the back? They can hear me? Okay, great. So sometimes a swear word comes out or two. I think I blame my father for that because it's the most descriptive word sometimes that comes out of my mouth. It's not meant to be disrespectful. I also like to get some interaction from you, yes or no. I'm sure you've noticed. Just so that I can see where we are with the talk and if I have to go in another direction that might be more interesting for you particularly. And lastly, I'm going to speak to you at the end about an offer because I love what I do. And if I can see more people in the world and serve more people in the world by offering you guys some money off or some discount, then I'm going to do that. Is everyone okay with that? Yeah? Okay, brilliant. Okay, so let's get started with some stuff. So I think it's important. I feel at home with this community because I think a lot of you have started to ask questions possibly about your purpose, why you're in this world, especially if you've come from a place that's personally quite low. You're asking yourself these questions. My why of why I do what I do, I mean, I was born in Zimbabwe. I come from pretty good stock, as it were. Dad was a Springbok rugby player, so fitness and health was always a big thing for us as a family. My mom won a gold medal at the Olympics in Moscow in 1980. So she was also a sportswoman. So I come from good stock. So then, I get shit done. I'm a mover, I'm a shaker, I have my lists, I've got things going on, things that work for me. But I always remember this particular day where, and this has hounded me for years, I'd finished my final exams the day before. It was an amazing time. I'd finished my final exams, qualified, it was all great. And the next day, to celebrate, I'd had a lunch booked and all sorts of things. A facial, out for dinner, going to have a party. And I just lost the vision in my left eye. Like a broken window, like I can't explain, it was like broken glass, it gets all blurry. I just literally couldn't see out of my left eye. And I just remember thinking, I was petrified, what was going on? And then from there, once the vision went, I started to get pins and needles. My tongue went numb, I couldn't talk. It felt like I had a fat tongue. My arm went numb. And then after that, I couldn't see light, and it was hot, and then I had to get to a bed, and I got to a bed, and after I was in the bed, the searing pain of fire, I can only explain it to you, like a sword that is hot, that just is going into your brain continuously. And I didn't know really what it was, and I got into bed, and all I could do was just put pressure on my head, so I was just holding my head. Next thing, I was in the bathroom because I was vomiting uncontrollably, so vomiting, retching, had nothing in my stomach, to realize that there was a migraine or a migraine. I don't know how people pronounce it. So from then on, they hounded me. I had them regularly. I couldn't put any patent to it. I did a lot of research, a lot of reading on it. So my why is because that really didn't allow me to be the person I want to be and do what I want to do. And so having had ABC in my life, it's changed. I have something that can help me and get me through. And yes, do I get them sometimes? Yes, I do, but I know exactly why I do, because I've neglected X, Y, and Z. So that is my why. That's why I'm doing what I do, is to help people who've got health issues going on get some answers. So let's get into what we're going to talk about today. Sorry, Chris. Go ahead.
Did you just say that?
Yeah, that's it. Perfect. Done.
Okay.
So very quickly, because I'm so passionate about posture and posture correction, there's a great article I'm going to talk briefly about a power pose. That's what I said in the write-up about what you can do for yourself in 2 minutes to change your physiology and your hormones. Then we're going to look at your nervous system very briefly again, but just to give you the overview of a normal one. And then we're going to look at posture. What is good posture? What does it mean? And then ABC. So Stuart will come in for that. And then at the end, we'll look at some case studies. And then, as I said, after that, we're available for any kind of chats. So you can move on. Okay, so posture. Posture affects focus and decision making. How long do you think it takes for somebody to make their call on you, whether they're going to like you, invest in you, date you? How long does it take before you've summed someone up when you meet them for the first time? Any ideas?
3 seconds.
Man, what have you been reading? So it's 3 seconds. So you've already made your call, whether you're going to trust me, love me, hate me, is it my hair, dress, body sense, what is my posture doing, how am I talking, is it irritating, whatever the accent. So people make their call on their perceptions. So isn't it interesting with non-verbal communication, which is body language, how much you can communicate with somebody? I mean, just a handshake. You know when you handshake someone and it's like a dead fish? Oh, I remember playing sport, and at the end you hand, and people are like, oh, it gives me the heebie-jeebies. Anyway, so important for how we look and how we present ourselves to the world. And in terms of a doctor-patient relationship, there was massive research that came out where people were watching clips of a doctor and a client together, or doctor-patient together, and it had no sound. And they were pretty much basing whether they were going to sue the doctor for malpractice on whether they were nice people or not, rather than their competency. So it's important stuff. Thanks, Chris. So let's look at this first part of it. So this actual research, I've pretty much taken it out of TED Talks. I'm sure everybody here is familiar with TED Talks. Her name is Amy Cuddy. So she was a social psychologist. And what really hit home for me is that she was wanting people to spread this message because it helped her so much. So let's go into it. So how does your posture affect our thoughts, feelings, and physiology? The other way around makes sense. Your mind can affect your body. But can your body affect your mind? And can you change your mind by changing your body? So these are some of the questions. Thanks, Chris. So if we just turn to a powerful, dominant posture, in nature we can see it everywhere. Cobra makes himself as big as possible, the gorilla, and then obviously when birds are fighting in the streams and rivers around here, they make themselves as big as they can. Next there. In the human world, so this is now just a snapshot into being superior and having a power dominance. We all know who that is. That's Usain Bolt, the fastest man in the world. Turns out that if you are congenitally born with blindness, and you've never seen this before, in a race that these people ran in Paralympics, they actually put their arms up. So it is inherently built in us when we feel superior and powerful that our arms go up and we make ourselves bigger. Next. The powerless is obviously the other way. Now, who would agree that the lifestyles that we're leading these days, which is something we're looking to biohack, is promoting this kind of posture? Yes? Everyone's hands up? Yeah. Okay, so that's where we start changing structure, and how does that change our physiology? So let's get on to it. Can we fake it till we make it? So can our bodies change our minds? Next one. These are some of the characteristics of if you're in a non-powerful posture versus a powerful posture. So I'm not going to go through them too much because I want to get through this as quickly as possible, get all the information across to you. The two bottom ones might be of most interest to you because it affects your testosterone and cortisol. So when you think about testosterone, it's there for power. It's also there for decision making, clarity. And then you've got cortisol, which is obviously stress management. So high cortisol, you're not managing stress so well. High cortisol, you're stressed out and you can't manage stress, yes, of course. And lower cortisol is a good place to be. So let's see now what her research showed. So in terms of postures, we've gone to powerful postures in terms of that with Usain Bolt. Some other ones, Superman. Some other ones, lying back at your desk, arms up. Her research was, they spat in a test tube, they held a power posture, they asked some questions about gambling or taking risks, and they spat back in the test tube, and then she got the results. So this is the power posture that they held. The other half of the group held a non-powerful posture, which is, and looks like this. The worst, most defeated posture out of all the research was somebody holding onto their neck. That would actually affect your physiology the most. But anything, hands on your head, I mean, we do this on a daily basis, especially looking down at your phone. So that's somebody holding a 2-minute posture in that position. Next slide, please, Chris. These were the results. So cortisol decreased by 25% if you just hold a powerful posture for 2 minutes. Testosterone increased 20%, and then you can see there's slightly less on this side. But I mean, what a change. 86% people made decisions on gambling, so they took more risks. So what does this mean for us in daily life? Next one. Where can you use this? Next one. So in high stress situations, if you've gone into your, is it not coming up? No. Okay. So where can you can just keep it on this one. If you're going to go and stand in a toilet cube like this for 5 minutes, 2 minutes, or I don't know if anyone saw me go into that room there and do a power pose for 2 minutes. I was literally standing like this for about 10 minutes. I was getting my testosterone up and I was getting my cortisol down so I could come and speak. So you can use it on a date, you can use it for a speaking event, you can use it for an interview, anything where it's high stress. On the back of this is not my normal posture. This is my normal posture. I've got stuff going on with my posture. Today, I'm going to show you how I can correct this to this, which is not overdoing it, but it's certainly going to be corrected, and have a similar response. So it'll be holding my body upright without a muscular effort, but looking a hell of a lot better than this. I'm showing you on me, but we can show you on you, which is going to be a lot more powerful. So let's see what's up next. Let's turn to the nervous system. Some interesting facts about the brain. It's only 2% of our mass, but it uses 25% of our calories. Okay, 86 to 100 million neurons, which are nerve cells, and you've got 10,000 synapses. So the brain is a very intricate machine. You've also got, 1 trillion bit per second processor. I can't even comprehend that. So I don't know about you. It's just a massive link up of computer. I don't know if anyone is a computer person here and can actually put that into context at all. Anyone? Pardon? Pretty damn fast. Thank you. Okay, so let's have a look at the brainstem. Now I'm going to focus on the brainstem. It's the stem of your brain, no surprises. Have a look at some of the things the brainstem controls. This is probably one of the most interesting slides for you today, because you can link up problems with pulling or tension on your brainstem with any of these going on with you right now. So Marek Doyle, I think he's spoken here before. He's been in our office for himself for many years, and he sends a lot of people to us and vice versa. So sleep issues was a big one, and digestion, because that is controlled and managed by the brainstem. So when it comes to moods and energy, anxiety, when it comes to balance, dizziness, brain fog, lightheadedness, these are all very common things the brainstem can be involved with. Next one. Coming to the spinal cord and the nerves. I see a lot of children in my office, and they always think this is a dinosaur. So this is technically what we should look like. Okay, we should have a nice 3 smooth curves from the side, the neck, mid back, lower back, and then from behind we should be straight. And we've got 24 movable bones called your vertebra, and you've got your discs in between, which are your shock absorbers. So they're like 70% water. So if we didn't have those, going for a run would be really uncomfortable. There's not much shock absorption going on there. Brain is at the top. Spinal cord runs all the way through the middle, and then your nerve roots come out at every level, and they give information to every muscle, gland, tissue, and organ. So if I was to go in there and cut a nerve off, pretty much that organ would die. It doesn't get any information, it can't live, it can't maintain. So at any one time, your brain knows exactly what every single cell in your body is doing. That's how we should function, because then there's healing taking place, there's communication, there's a whole lot of things going on that we don't even have to think about. Any questions on that? No? The meninges, this is the last thing for you to kind of grasp this concept. Has anybody here heard of the meninges before? Yes? Okay, so very basically, I want you to think of it like a skin that covers the brain and covers the spinal cord. This skin has 3 layers to it. It should be loose, it encases it, so it's quite fibrous, it's got some protection and some nutrition. When the bones on the outside and the shape of your spine change in specific ways, those meninges can be affected. Now, as I said, they should be loose, but if they start getting pulled on, or if they start tightening up, the communication between the brain and the spinal cord starts going down. Because does anyone know how we communicate between the brain and the spinal cord? Is it electrical impulses? Is it fluid? Yeah, so probably some electrical pulses in the brain, but the CSF, cerebrospinal fluid, it's quite a big word. It's all to do with how our liquid moves from our brain down and then back up again. And there's no valves there, so it's not if it can be pushed up. The only way that we can get the CSF to go around our brains and our bodies is to move. That's why movement is so important for health. So that is me, because I've given you the background on the normal, and now we're going to get the crazy on and start talking about how this changes and how we can get it as close to this as possible again. Thank you.
So I'm Stuart Murray. I'm a South African born on a farm. And when I was a very young boy, I liked taking things apart. And to my mother's dismay, because I couldn't always put them back together again. But that's been my ethos my whole life. I like to work things out and sort of find out the root cause or how things work. So growing up, I soon realized that I loved helping people. Really loved it, and I loved the feeling I got from seeing someone else do well. So I decided I want to become a doctor. Truthfully, not smart enough to become a medical doctor, and the other side of that is I never really liked the idea of doing prostate exams. So I just put that to one side. And then I looked at physiotherapy or chiropractic, and my ego got the better of me, and I took chiropractic because I would be a doctor of chiropractic, not having ever been to a chiropractor before. But I like the idea of sorting out bodies. It took me 3 years into chiropractic college to realize these people don't know what they're talking about. It's a 6-year course, by the way. Okay, so where did that leave me? I left pretty dejected. I lost complete interest in my studies. I started scraping by because I thought maybe if I got to the end, things would get better. Truthfully, I finished up, I came over to the UK and I started doing different courses because I thought maybe if I could find out how the body really worked, I could really help people. I'll fast forward on to, I think it was 2 years into this whole experiment, and I was sitting on a bench in my practice after a nice busy morning, and I was looking for jobs to become a medical rep. Pretty low moment for me because all I'm doing my whole life is trying to sort things out, and I know that being a medical rep is not really going to be doing that. What am I going to be doing? I'm going to be sort of covering up symptoms, right? Becoming part of the problem. And just by absolute dumb luck, a friend of mine put a post on about chiropractic, and someone said, don't worry about trying to stand up straight, just do ABC. So I was like, what's this about? A little bit of hope there. And to be quite honest, the entire experience that I went through was I researched it, it sounded very good, it sounded too good. And being a little bit of a cynic, I went after it, I got adjusted for the first time, and I have been doing ABC for 6 years ever since that day. I have not looked back, I do not do any other things, even though I am open to other things, because that's a poison in its own right. You can't become all one-sided. Even if we become, as this group of biohackers, if we become too one-sided and are not willing to learn, we become a poison ourselves. I don't know if everyone agrees with that. Always got to be open to learning. Okay, so in the 1800s, they discovered DNA. I don't know if you know that, but it took them 150 years to then actually work out how this whole double helix was structured. Now, that was done by Watson and Crick. And the miraculous thing behind that was they discovered that this very complex DNA structure was actually made up of only 4 elements. Adenosine, cytosine, what are the rest of them? Guanine and thymine. There we go, I think I got that right. So if you take the entire 3 billion code, it's just a different combination of that. So it's very, very, very simplistic, but it's also very, very, very complex. Does everyone agree on that? Yeah, DNA is quite complex. Right, if you could put the first, no, you can move on, thank you. And next one, right, thought experiment. Would you guys agree that a Lego brick with 8 studs on it, if you had to stack 2 of those on top of each other, do you think that a vertebra could move in similar planes to that? At least eight directions, because it's got 8 studs. Is everyone in agreement on that? Basic stuff. Can I please say, yeah, yes. Yes, okay, good. All right, so if you put 2 of them on top of each other, they can make 46 different combinations. 46? 46. No, I didn't do the maths. Woo, not my speciality. Okay, and I want some numbers being thrown around here. If you had to stack 6 of these on top of each other, how many different combinations could you get? No, man, not lots. Come on, I want to hear numbers. Come, let's hear. Sorry? Okay. Thousands? Millions. How many millions? Come on, guess, guys. 28 million. Can you do the next slide? 6 bricks is 915 million different combinations.
That's what I was thinking.
You said millions is right? Okay, if we add 1 brick onto that. Okay, I can't say this number, but can you pop it up there? I think it's 85 trillion, is that right?
Yeah.
Is that right? Okay, all right, cool. Yeah, exactly. Yeah, trillion, billion, 8.5. Anyway, long story short of this is what? If we had to take 24 movable vertebrae, how many different combinations could each and every one of us get into? Let's say an infinity. All right. We can't work that out. It's far too complex. Far too complex. The amazing part about what this man, Jesse Jatkowitz, discovered was very, very, very simple. but very, very, very profound. Okay, and you can pop the next one on there. So we know that vertebra can go sideways, all right? You can tilt, you can twist, you can bend, you can extend. Okay, and then every other combination between that. Right, if you hit the next slide. The only thing your body can't do is take a vertebra backward.
How do you extend it back?
Where is that? Where did that come from?
How do you have extension? Spine.
Extension is not translation. Extension is you have your erector spinae muscles and they actually extend your spine. That's not translating a bone, slightly different. But that's the right question. That is the right question. Okay. If, for the moment, let's just take it as this is true, and we'll show you that it's true on each and every one of your bodies if you so choose. Every little bit of problem or muscular problem you've ever had, or bony problems or irritation, has come from this as its genesis. The bone goes forward, body doesn't have a muscle or group of muscles to pull the bone back, and you have to compensate. Now, you've been doing that since the day you were born. In the womb, as you got pulled out, if you went out through the sunroof, right, you got pulled and yanked. If you got pushed out vaginally, that's a little bit better, but then sometimes they have to pull you because your arm got stuck. So already there, you're starting to get these little manipulations and changes in the body. So it starts from that very, very, very young age. And I'll just, if you go to the next one there. So this is the key points. And it's so simple, it's silly. Like no one's here going, wow, that's amazing. That's interesting. It doesn't seem like much, but this is what causes everything else. So bones go out of place in a direction the body cannot self-correct because there are no muscles pulling in a direction needed to pull them back into a place and correct them. So you don't have any tether at the back here. There's no tether. There's nothing for me to attach to move that bone backwards. Right, so how does this affect everything else? If you go there, and next one for me. And if we can hit, this is what a compensation pattern looks like. And this is a typical one because this is like something you would have if you get a lot of headaches. This will sort of ring true to you. Okay, so this is the compensation pattern that's been set up. Okay, this is your primary PBP or your primary bone out of place or pathology. Let's say something goes along and knocks that forward. Your compensation for that in that instance is to slightly extend your spine. Okay, and obviously overactivating those muscles and they'll be slightly irritated because of that. That then drives this bone further forward and actually locks it in place. Okay, and through that we've now got this slight pivoting forward of the body and a collapse there. That then in turn makes you slightly compensate up top here. Okay, pushing another bone forward. We don't really want the head looking at the ground, so what's the compensation for that? It's to lift the head up. And as you'll see here from the whole compensation pattern, where the problem ends up being here, or the symptom, right, is going to be all the way up top here. Now you can give that a massage or a rub down, and that will feel better. There's absolutely no doubt about it because that muscle's been overactive and overstrained. But if you ever really want to get down to the problem or the genesis where it all started, you need to fix the bones that are stuck forward so the body then can let go of the compensations. Any questions on that so far? Yeah.
So how do you point out which vertebra is the problem?
Very good question, and I will get to that. Very, very good question. It's part of the problem with chiropractic is that there was never ever a way to actually find out what the primary problem was. You just go, oh, this is not moving well. Yeah, it's moving better now. Yep. Yep.
Okay, mate.
Yep.
Yeah, so if you've had this problem for an extended period of time, like 20 years,
Yep.
can the damage long term be undone with treatment?
I'm just going to say no to that as a blanket. That's not entirely true, but not entirely false either. We'd have to have a look at you, and also it depends on what the type of damage we're talking about. But most of the stuff we can fix, but if we talk about advanced arthritis or something like that, my hands get a little bit tired. Okay, moving on to the next slide. Okay, so Natalie spoke a bit about the meninges a second ago. The problem with meninges, and this comes down to a guy called Alf Brigg, he did the studies on Pons cord track, so how well this moves around in the spinal column. Now what he realized is that if you flex your body forward, you actually pull on the base of the spinal cord for between 6 to 8 centimeters in full flexion. So that's, let's say it's that much. That's how much you're actually pulling on your nervous system. So if we're talking about those areas in the base of the brain, in the brainstem, where all those stimulations in terms of sleep and all the rest comes from, and your immunity, if you are stuck in perpetual forward flexion, that is going to be harming that area. Okay, so what we talk about here are adhesions in the spinal column, and you can see here that's actually where the meninges lie. That's that area there, and that's that. Oh, no, it's weird. It doesn't work on the screen. So where those arrows are is actually where the adhesions are. So when someone says to me that they can correct the spine or the nervous system with those adhesions intact, I'm always a bit skeptical of that, because the meninges are strong enough so that you can actually tow a vehicle. They've done it, strangely enough. They've actually towed a vehicle with someone's meninges. They've tied one vehicle to the next. So it's not like it's this little gentle thing. It's very, very fibrous and very hard. So when that gets stuck and twisted up by these compensations in your body, that tethers the cord. And that's what we call tether cord syndrome. And that's what happens in the brainstem. And this has been very well documented, even though it was many, many, many years ago by a man called Alf Brigg. Okay. We get people into very strange positions, as Adam will know, and that's how we actually release this tethering area, because how he did it was through surgery. Now, not many of us have access to surgery that we can just go and get some meninges loosened up quickly. So what we do is we use this as a way of loosening up, freeing up the meninges, and then allowing the rest of the spinal cord and the dynamics to then take place. Takes that tension out of the spinal cord system. Okay. And if we just go on. Okay, so this gets back to the question about how do we find out where the primary bones are. Okay. That comes down to this, the synchronous testing. So what we do is we run through all the vertebrae in the body, we give them a little push forward, and we see how the body actually responds, and that's how we know. It gets a bit more technical than this, which ones are the primary problems and which ones are compensations. We do not touch compensations. We do not touch compensations because the body's put it there for a very, very good reason. You start messing with that, you wipe out compensations, your body has to compensate for the compensation, making your body even more tightly wound up and creating even more tension on the brainstem. Okay. We only ever adjust vertebra from front to back, from anterior to posterior, and we let the rest of the body take care of the technical stuff. Because remember how many billion types of combinations we can get? I cannot know to put that vertebra X amount of distance. We just got to take care of the stuff we know we can. We do meningeal releases, which I touched on, and then we are very, very careful with how you sit, stand, and sleep. Because it's no good us fixing these bones that are stuck forward and you recreating them as soon as you leave the office. It doesn't give your body a time to let go of the compensations and the twists in the body. That is, and yes, the last thing is we actually adjust the whole body on every visit. The body is a synchronous unit. It works as one thing. You can't, it's like a chain, you can't have an effect on, for instance, if you kick your big toe, that affects how you move your entire body. We can't have a neck adjustment only. We've got to look at the whole body. All right, and then lastly, don't worry about these facts here. We've got lots and lots of different photos here. You can actually just slowly but surely go through them. Now all these people are standing completely relaxed. Right? This is not a muscular effort. The instructions are take a deep breath in and out and let your body slump. Because the common misconception is that it's muscles that control your posture. I know you can stand up straight. I'm not arguing that point, but that then mitigates the shape of the spine. Okay, you need to have the 3 smooth curves to allow the meninges and allow the pons cord tract to be relaxed for you to be fully functional and the healthiest person you can be. This is not saying that anything else isn't necessary, but this is a very, very important fact behind it. You can carry on going through them. Do we have any questions on that?
One question.
Yes.
So after you towed the vehicle with the meninges, did
Yes.
you get back to the guy?
That guy had already kissed the dirt.
Right, quick question here. How does this work with something like a slip disc?
Oh, yeah, okay, slip disc. The problem with the slip disc is the cord is actually slightly under pre-tension because of all the adhesions. So instead of it, your meninges being loose like this, okay, your meninges have tightened up from life. Let's just say you've had all these other things. Then you have the slip disc. It then has no give.
Is that when the body starts to compensate and you kind of get that sort of S-shaped bend? And
Well, you're supposed to have an S shape from the side.
no, but it kind of throws you out. You're compensating for obviously the pain and.
Yes, that's more the antalgic gait, which is all the way you move, is where you're actually moving away from the pain side. That's not the same as this. This is internal. So this tension is built inside of those meninges. So when the slip disc actually pushes out and creates a bit more tension, then you get this heightened tension.
Does this help, let's say, mitigate against
See this?
the slip disc?
See this? Tight,
Yeah.
push it, loose, moves around it. Tight, tension, loose, no tension. That's what the stretches do. They loosen up the meninges enough so that they actually are loose again. And that slip disc is still there. But the effect it has is far, far reduced because it's no longer pulling on this entire system. It's a very different way of looking at it because you're not actually fixing the slip disc. You're allowing the body to actually have adaptability again so it can actually move away from it. The reason that disc went in the first place is actually because of the strange shape that you were using it in, because of all the compensations. So if we can actually restore that body and into a much better mechanical position, you no longer have the mechanical pressures uneven. It's actually the compensation for something else that's the problem. So for instance, I've got a problem here and I collapse. Look at my lower body. Okay, just as an example. So now there's extra pressure in my lower body through that disc. Over years, it eventually wears out, and then on the fateful day you go pick up something, it goes.